Hi, today I want to go over the chronic care management enrollment process, along with maintaining and creating a care plan and billing for the chronic care management templates. So the first thing your clinical staff would want to do is they would go to File. They're going to go to System Practice Template. They're going to click Show All. They're going to select the Practice tab. And you can select the CCM Population Management. So these are all the patients that are currently enrolled in CCM. You can sort the filters by Show All, billing issues already billed for this month or ready to bill. You can also sort it based on the month. You could highlight and open the patient's chart. You can organize by provider or patient. This is also where you would go to unenroll a patient or suspend if they're already enrolled in another practice somewhere else. So suspended patients will show down here in the grid below. So if you want to enroll a patient in the CCM, you'd identify the patient to enroll, and you would identify them by going to the CCM Opportunity Dashboard. Here, it would be a list of patients' names based on the payer's name, the PCP's name. You could highlight, click Open Chart. This is blank right now because this is a test system. You can generate a report from here. So this template identifies who the patients are that have a participating provider, who have 2 or more chronic conditions that are opportunity eligible, are alive, and are not yet enrolled in the chronic care management. And it's going to look for patients with visits in the last 36 months. You can filter by the payers or by all payers. So I'm going to pretend like TPMG Gibraltar is here, and I'm going to click Open Chart. I wanted to show the intake screen because I have added a tab called CCM, and if you click this tab, you can enroll them into the chronic care management from here, or if you go to the history bar, the templates are listed right here, and I also added them on the navigation bar. So I've put it in as many places as possible for providers, thinking of everybody's workflow. But I've talked to my patient, and they do want to enroll. So here it'll show you the provider, the practice, and the location. I've gone over the consent with the patient. The patient's given me consent. I've printed the form. I've had the patient sign the form, and I've scanned the form into the patient's chart. So then I'm going to click Enroll into CCM. And now the patient CCM status is marked as enrolled. And you can see their status right here as well. We've added that right here in the patient information bar. So the next thing I'd want to do is go and select my payer. Payers are already going to be there. This one's not. So I'm going to just go and add a payer real quick. I'm going to add their policy number. Then I'm going to close it. And then when I go back here, my Medicare is going to show. If you or your staff, your clinical staff, forget to add the payer, when you go back to the CCM billing side, it's going to show patients that their payer is not listed. So you have the opportunity to add them as well. So here for my CCM billing diagnosis, I don't have anything here. This information pulls from the billing ICD-10. It also pulls from the problem list, but if you're adding diagnosis, if you're selecting diagnosis for billing from the problem list, this ticker here is not going to count up. It's only going to count 1, 2, 3, depending on the conditions that you've selected if you're pulling from the ICD-10. This patient, I'm going to select them for major depression, diabetes, and now I just want to Go to my billing ICD-10. I'm going to add ICD-10. I'm going to mark it as chronic, and I'm going to accept. Then I'm going to close out. And then you'll see if I go over here to chronic ICD-10, I can select that for billing, and you'll see that this ticker's counted 1. But really, we've added 3, so don't let that confuse you if you only see 1, because that number is only pulling off of the ICD-10 chronic list. So the next panel is the CCM service. So what type of service are you enrolling the patient for? I'm going to enroll this patient for coordination of care. My CCM start date is the 23rd. You cannot backdate this. And the minutes to perform, I'm going to choose 20 minutes. It also has a timer if you wanted to use that. You have the ability to create my phrases, and it'll actually open to the phrase type, so you're not having to search for that like other places in NextGen. There's common phrases, and we can build as many of these common phrases that you guys decide upon. And you would click Add. I missed the submitting the G0506 code. You can submit that if it's applicable. Sorry, didn't mean to add problems. And then that's all there is to managing or enrolling a patient in the CCM program. So now that I have my patient enrolled, I want to create a care plan for them. So to do that, I can click this little care plan button down here at the bottom, and it'll open the care plan template. My patient had a recent ER visit at regional. The date was on Monday. The diagnosis was COPD. I can add any notes that I want. I can add any comments that I want. If they had a recent hospitalization, you can add that. Care coordination team. You can add as many agencies as you want for this. Your interdisciplinary team. I've only added myself, but again, the care coordination team and the interdisciplinary team, this is location specific. It's only going to pull in those teams based on who you have me set up. Problem list, if I want to address any problems. So you see I've added COPD, so it's going to pull in my problem list. There's common phrases that we've added. And these are just some generic ones. We can decide which ones that we want to use as an enterprise. Again, you still have the ability to create my phrases, and it'll open up to the spot that'll save your my phrase, so you don't have to go in here and search like you do in other places. And if the patient had more than one problem that you wanted to monitor, as long as they were listed above, you could pull them in and add as many as you want. Any interventions that you want to add. Again, there's common phrases, and you can add my phrases. Responsible team members, you can add that. And I keep saying you, but I mean your clinical staff. You can have a start date on this. Frequency, daily, weekly, or monthly. Next intervention is due next week. And again, there's common phrases, but it means that you want to add your progress notes here. Any symptoms management that you want to manage, you could add those as well. Coordination with, home health, pharmacy, family, DME, nursing homes, you could add that as well. Medications, you definitely want to reconcile these at every visit, or when you talk to the patient, because one specialty provider may add this medicine, another one may take another, so you want to make sure that their medications are up to date, just as you typically would when a patient's in the office. Tobacco status, this still has to be reviewed. If nothing's changed, you would just click reviewed, save and close. Mental and cognitive assessment, it'll show you all the assessments here. If you want to add any, you have the ability to go to your screening tools and add more mental exams or cognitive assessments. Your care plan, we have it set for 1 year to be reviewed, but you can change this. Care plan reviewed was today, and you're going to submit it. If you want to add any goals for the patient, you can add goals here. And once you've completed the care plan, you would just generate your document. And you can review the document. If the patient's on the portal, this is a good thing to send to the portal. We'll fix these little macro errors where it's, not being written out. And that's all for enrolling a patient and managing the patient encounter. The next thing I want to go over is the patient coordination and management. This is your telephone calls with the patient. So you can go to your templates, or you could have went to navigation, and you're going to select the CCM telephone call. You're going to click OK. And this looks like the telephone call in our system right now. They spoke with the patient. The contact type was an incoming call. You'll see that they added this CCM service type. This time the patient has some medication questions. I'm on the phone with them for 15 minutes. You see, once I added the duration, it'll say send to CCM grid. If you have any my phrases, you can add them. If you want to create them, you could create them. And then you're going to send to the CCM grid. And then you would save and close, save and send, whatever practice you use in your office currently. The last template that I want to show you is the CCM provider test action. Of course, after you identified the patient's chart's open, you're going to go to the correct encounter or create a new encounter. It's up to you. You're going to open the CCM provider test action. Remember, you can get to it from here. You can actually get to it from the CCM or from the navigation. You're going to review the appointment information, review the contact information, and then under the action log items, you're going to address in the appropriate orders. You'll see that the chronic care management button here. So you would select the chronic care management checkbox. You're going to enter the duration minutes, enter any notes or to-do items, and then you're going to click Save and Complete button, and then you would select Test Action at the bottom. I don't have any of my phrases. I don't believe I've built any common phrases, so that if you have any of my phrases, you can use them. We can build common phrases. I'm going to add my time of 5 minutes. And if you were going to task it, you could task it. If it was Save and Complete, you would hit Save and Complete. So we've gone over all 4 of the templates: the CCM management template, the care plan template, the CCM provider test action, and the CCM telephone call. The next thing we'd want to go over is how to bill. So when your clinical staff or your billing staff want to go and bill for all the CCMs for the month, they would go back to File, and they would go to System Practice Template, and they would click All. Again, you would go to the Practice tab, and you would go to the CCM billing. And I don't know if I showed you this, but we did add the CCM status enrolled up here on the patient information bar. So you would choose the month and the year range that you wanted to bill for. So I'm selecting March. The thing about this chronic care management billing is it pulls in all providers. There's no way to filter it by Dr. Ciccone or Dr. Sharp or Dr. Williard. You have to pull them over one at a time to select a charge and to process the charges. So I don't know if we want one central person doing the billing, or if your office is going to be responsible. I think that's something we need to discuss at the CTC. But I want to bill everything for Dr. Ciccone, so I'm going to pull his charges over, and then I would hit process charges. And if I had enrolled a patient in CCM and I forgot to select their payer, the Medicare, the second tab on the management template, they would show here, and I could open the chart, or I could just set the payer. So again, the population, this is used to show patients enrolled. You can unenroll them, you can suspend them from it, you can pull a report from this. This is a real good system practice template to have. The opportunity dashboard, again, it'll pull in patients who have a participating payer, have 2 or more chronic conditions, are alive, and are not yet enrolled in the chronic care management. And you can filter by payer, and you can also generate a report. So this concludes my little workflow on how to enroll a patient in the chronic care management templates, how to manage a patient who's already enrolled, the provider test action, and telephone call. If you have any questions, feel free to reach out. Thanks, and have a great day.